Good afternoon and welcome to our webinar, Get Hip to HIPAA 2023 Best Practices. Our presenters today is Phoebe Nams, Associate Project Director here at Hybrid Solutions, myself, the Program Manager at Hybrid Solutions, and we have a special guest today, Ariane Parham, the co-founder and compliance expert at Ham Tech Solutions. Today's objectives are overview of HIPAA and security risk analysis, review updates and changes, and suggest compliance tips. Why is it so important to prioritize HIPAA compliance? The federal law protects people's healthcare data, protected PHI. It prevents healthcare fraud and identity theft. It avoids penalties from the OCR and legal fees. It, of course, maintains patients' trust and patient reputation. Global cyber attacks has increased by 30% last year. Healthcare was really hit hard. The healthcare, education, and government were the three industries most impacted by cyber attacks in 2022. I'm going to turn it over to Phoebe Nams and, of course, our special guest and our expert, Ariane Parham.
Thank you so much, Selena, for that lovely introduction. So really our objective today is, because this is a topic that we've discussed many times and you're very familiar with, but we really want to stress the importance of creating cybersecurity awareness within the entire organization. And so that's why we're so happy to have our special guest with us today, Ariane Parham. He's the CEO of Ham Tech Solutions. And I just want him to give just a brief introduction as to why he cares so much about creating cybersecurity awareness and compliance within the healthcare system.
Hello, everyone. Thank you for having me. I've been in the healthcare space now for close to 15 years. I started in a medical practice. It was multi-specialty, electrophysiology, OBGYN, and also family practice, all sort of mixed into one. And being a part of that organization, as I'm sure many of you, I had to wear like multiple hats, from anywhere managing the IT, managing the facility, to even sometimes going to get the managing physician's car from an oil change. So I'm sure there's different things mixed in there, but one of my core responsibilities was making sure that I take care of meaningful use, which is the predecessor to what's called macro MIPS now. And so when the program first began, it was optional. You could submit your measures and you would receive an incentive, but then it became required. And in that first year of it being required, all you had to do was basically check a checkbox for all your providers. And unfortunately, 10 plus providers that I was managing at the time, I missed one. And that one that I did not simply check the checkbox for ended up costing the practice hundreds of thousands of dollars. And so that's why I do what I do, because I don't want you guys, with all the many hats that everyone wears, to not miss on taking care of compliance issues or different things, especially when it's something as simple as just checking a checkbox. So.
Wow, so your pain becomes your passion.
Of course, yes.
Well, we appreciate that. We're really glad you could join us today, because research from Stanford University and a top cybersecurity organization found that approximately 88% of all issues or data breaches are caused by an employee mistake. And although that wasn't the case in your situation, it did really highlight the importance of compliance with all things HIPAA, because it's really critical to protecting not only the patient's privacy, but also the practice financially, yes, their bottom line.
Yep. Mm-hmm.
Because as you highlighted, it can result in severe penalties, including fines, plus other more severe penalties. And then the impact on patients' trust and reputation. That's something all practices want to avoid at all costs. So as we move on, everyone kind of is aware of the basics. These are things that we all know, that there are the three basic segments of the HIPAA compliance. the privacy rule that governs the use and disclosure of protected health information, and that healthcare workers have to obtain written consent from patients before disclosing their personal health information and take appropriate measures to safeguard it. And then the security rule that outlines the technical safeguards that healthcare workers have to implement to protect PHI. And of course, this includes access controls, data encryption, data backup, and then the breach notification rule that requires providers to notify patients and the Department of Health and Human Services in the event that there is a breach of their PHI. So as we move on, again, with the basics that we need to do, we should start by creating and implementing effective cybersecurity standards, policies, and procedures, and not in your head, but written down somewhere where everyone can access your staff.
Sorry, I just want to jump in. I want to
Please.
emphasize that point. So I work with a number of organizations in helping them to complete their HIPAA risk assessments as well as be HIPAA compliance. And so this is the number one issue that I find outside of completing the security risk assessment. It's documenting your policies and procedures. And so when I go into an office and I ask for the policies and procedures, of course, they go to the shelf, right? The shelf with the binder that's been collecting dust for 5 to 7 years and sort of just brush it off. And it's like, hey, here you go. We don't want to do that. So sorry, I had to chime in and share that.
Oh, chime in anytime. Right. So how is the staff to have a book of truth or, a source of knowledge if it's not constantly updated? And so that covers also that they should be properly trained. And the administrative policies and practices should all be HIPAA compliant, and to make sure that the policy is well documented and communicated to everyone in the organization, because we don't want the weakest link to be the cause of an issue. Good question. We'll get to that. Implementing the safeguards, we want to maintain HIPAA compliance to safeguard PHI physically and digitally. Any physically stored information should be accessible only to authorized people. And then the digital aspect would require strong passwords and login security be implemented. And risk assessments. Every covered entity should have an annual HIPAA risk assessment. So if you haven't already started planning for 2023, now's the time. Risk audits should include all administrative, physical, and technical security measures implemented by the healthcare organization to achieve HIPAA compliance. And we also want to have a way to investigate whether a violation has occurred or not. In the ideal world, your entire organization would be HIPAA compliant every day of the year. However, errors do occur, whether discovered by you, an auditor, or a regulator. And if a violation is discovered, you got to put procedures in place to discover what's the root cause of that, and then create a remediation so that you don't have an occurrence of the problem again. So we have a question that might be good to cover in this slide. What are the differences between HIPAA risk assessment and security risk assessment? Is there a difference?
I can just share. No, they're one and the same. A lot of times when people are mentioning or talking about it, they may say just security risk assessment, cybersecurity risk assessment as it relates to HIPAA or HIPAA risk assessment. They're one and the same.
Right. So any organization that uses technology can conduct a risk assessment, but when we're talking about HIPAA, we're talking about the security risk assessment.
Correct. And as we mentioned, that risk assessment, as far as the security rule goes, applies to the technology within your organization.
Exactly.
And of course, we're going to go into more detail, right?
Yeah, but not just the technology, as we'll
of course
later on. Yeah. All right. So if we can move on to the next slide, and we'll talk about what information do we have to protect. It's good to review. I'll just throw in a quick personal story here. It has nothing to do with healthcare, but it illustrates the point to me. I recently got a new vehicle. Now, I've been driving for 30 plus years, but so I know how to drive, but the setup of the interior of that car is totally different from any vehicle I've ever driven before. So I had to adjust. I spent a couple of days going over the manual and making sure that I knew what was what. So it's the same with this. Even though we all are very familiar with HIPAA, and you know how to drive, so to speak, it's good sometimes to review the details. You know, what's new about this configuration? How does the changing environment in healthcare or in your practice impact you, and what you need to think about so that you are compliant continually. So what are some of the data points that we have to protect? Any individually identifiable health information. Now we've listed just a few here, but they're actually, I found a list that HHS, Health and Human Services, recognizes as includes 18 different data points. So telephone numbers, fax numbers, email addresses, social security, medical record number, health insurance, beneficiary number, account number, certificate license number, vehicle identifiers, which I would not have thought of, device attributes or serial numbers, digital identifiers such as website URLs, IP addresses, biometric elements, including finger, retinal, and voice prints, full face photographic images, and other identifying numbers or codes. So that requires some thought, you know, do we collect this? Do we store this? Does this pass through our practice in any way? How are we protecting it and making sure that no one shares any of these 18 data points? So I thought that was an interesting list to mention. But as we move on, keeping up with HIPAA compliance, there are several challenges to this, as we've listed here. I'm going to pitch it to our expert to see if you have any thoughts on.
And if I go too fast through this, please feel free to stop me at any point in time. I can talk about this stuff all day long. And so the first one, it's really important, medical devices. You may have that X-ray machine that you've had in your organization for 20 years now. For whatever reason, it's connected to the network. You need to look at some of these devices and really ask yourself, is it important for this particular device to be connected to the internet? And that goes along with, of course, doing your security risk assessment. You can identify some of those things, but medical devices is a big one because obviously a practice or organization has invested thousands of dollars into their equipment, and they want to use it until they can't use it anymore. And so, of course, sometimes that means it's a little outdated. And so, again, you just want to ask that question. And also, if you have support contracts current on those devices, you want to make sure that you're getting with your vendors to ensure that they're receiving the most up-to-date security patches and different things. And so, the same with social media. HHS really, they sent out guidance earlier this year or late last year, where they found that a couple of organizations, large organizations, had implemented like Facebook, Instagram plugins into their websites. And they found that because they did that, Facebook and other organizations, social media sites, they were actually pulling patient data from websites. And so a number of organizations got dinged because of that. So you just want to make sure, you want to be aware of not only what you're doing on social media as you respond to reviews, but also how you're using the social media technology on your website or different things. And so it's also important, as I mentioned with reviews, again, I know, right, that one particular patient or individual, they have just been bothering you. They posted negative reviews. Please try your best to not respond with any specific information, because that is, by you confirming that they're a patient in your practice, that becomes a HIPAA violation. And HHS has also gotten on a couple of providers for that as well. And so we want to make sure if there is a response, you want to have a social media policy that basically states that when you respond, it's something very generic. Hey, thank you for submitting this review. Please contact our office if you have more questions. That does not entail or agree or show that they're a patient of your organization. It's just you responding to a comment. Secure messaging. I run into this issue a lot. Nowadays, if you are connected to a hospital, most times they have a secure messaging app where you don't necessarily have to get one for yourself or on your own. But I know it's very tempting. Text messages, it's easy, right? You just go on your phone, boom, boom, boom. Patient is in the hospital, they're at bed or room, etc. Please, text messaging is not secure. And actually, all of the major providers, Verizon, T-Mobile, so on and so forth, they're legally responsible to hold on to a lot of that data for at least 90 days. So if you guys were not aware, your text messages are actually stored on their servers somewhere. So we want to make sure that we're not storing patient data out there freely. We mentioned updating policies and procedures. This should be a constant thing. Of course, there should not be dust on your policies and procedures or your binder. You want to make sure as the organization changes, whether it grows or sort of slows down, there's new equipment is added, different things happen. You want to make sure that you're constantly updating your policies and procedures. It's also important to have an in-house expert, whether it be a contracted IT person or you have somebody in-house within itself. And of course, hybrid solutions can help and assist with some of the questions that you may have, but you want to make sure that you have people that you can contact in the event of an incident, or you just have questions about, hey, should I update this? Should I do this? Or how does this look? It's important to have that, as well as training. Training. I cannot say training enough. Training. We need to make sure. And the reason why I stress this is because in 2023, nowadays, there are actually criminal organizations, just like corporations. They're businesses, they're set up. Before, a lot of these things used to be in the dark web, and the dark web is essentially just, it's the internet, but you can't Google it. You have to have special software in order to get to it. But nowadays, you can go buy some type of virus. You can just Google. It's easy. It's more reachable than what it used to be. And so because of that, you want to make sure that you're constantly, employees, everyone is staying up to date on the recent threats that are going on. And of course, the rising cost of cybersecurity. Just imagine if there's a breach, if you don't have cybersecurity insurance, you can essentially multiply, because if a cybersecurity incident happens, you have to provide credit monitoring services to each of your patients. So multiply $25 times how many ever patients that you have, plus any legal fees that you have to pay for, including any investigations, hiring computer forensics experts. It's astronomical. And even if you do have cybersecurity insurance, one of the things I'm reminding a lot of my clients is to go back and look and call and see, because of the rising cost of cybersecurity, a lot of the insurers are kind of pulling back on some of the things that they mentioned that they would cover. And so I actually had one client in particular, I was like, hey, let's pull out your policy binder. And she found out that they had sent her a notice saying that we no longer provide cybersecurity coverage. And it was in the middle of like this 200 stack piece of paper. And so we just want to make sure that if you do have cybersecurity insurance, that you check with your provider, hey, are you guys still providing this? And if you don't have cybersecurity insurance, you definitely want to get that, for all of the evolving cybersecurity threats are out there. And we also have to consider state regulations. Georgia has specific privacy regulations that we must follow. And you can go to the Georgia website to look at those in particular. But there are a number of privacy regulations that we have to adhere to as an organization. And of course, documentation, as I mentioned before, please keep this. It's important. If anything ever happens, if you're ever audited, you just want to be able to say, hey, here you go. Here's everything. I've documented everything. There's no questions as to whether we have policies and procedures in place, whether or not our staff members were trained, whether or not we performed our security risk assessments. We definitely want to make sure we hold on to that for at least 7 years. Did I go too fast?
Oh, that was awesome. That was awesome, but a little scary.
Yeah, sorry. Not doom and gloom. I just want to make sure everyone is protected and aware, because they're just, outside of treating the patient, there's so much that you have to ensure. And I understand that it can be overwhelming, but joining webinars like this, you can stay informed, and it's important to do so.
Excellent. When I put on this list, cost of cybersecurity, I was thinking that some practices are hesitant to invest in cybersecurity because they're their focus is on taking care of their patients and not realizing that the impact it can have on their ability to take care of their patients. And also the state regulations that may differ from the federal, but those take precedence or priority if they are in conflict, if the state regulations are more stringent than those are the ones that apply. So we need to kind of know what those are for whatever state we live in. And so another thought that I found during the research was that any designated record set that contains information such as a medical record, a billing record, a case management record, even if they do not meet the definition of individually identifiable health information, and as such must be protected, and information in the same record, whether it's PHI or not, must also be protected. So many details to account for. As we move on to our next slide, we'll see how, in spite of all these challenges, the security risk analysis can help us. This is the actual rule requiring that a risk analysis is required, and it has to be conducted accurately and thoroughly to assess the potential risk and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information, and also the management of risk, implementing security measures that are sufficient to reduce risk and vulnerabilities to a reasonable and appropriate level to comply with the security rule. So as we move on, we'll see how the security risk analysis can help us to meet the challenge because of its details. And can I pitch it to you again?
Of course. And one of the things that I like to mention, I know that it can become a pain, right, to do the security risk analysis. I know, trust me, anyone here, I know, I understand, but it's actually the foundation of protecting your patients digitally. It's what allows you, it's like your annual visit going to see the doctor, right? It allows you to get that checkup to see what you've been missing, what you need to work on, so forth and so on. And so it's not just about your EHR. It's not just about your computers. It encompasses policies and procedures. It encompasses making sure that your computers are up to date. What password policy do you have? What disaster recovery solutions do you have in place? Do you have something in place if there is an incident? What's your response plan? So forth and so on. It encompasses a lot of things, and it allows you to truly get a full picture of where you stand, cybersecurity wise, as well as policy procedure wise within your organization. And so within that, though, as you conduct the assessment, you look at what are the risks to my practices, right? Some of the environmental, if you're in Georgia, tornadoes, for whatever reason, have been getting crazier and crazier. And so that's something that we definitely want to consider. If a tornado hits my practice, and I have paper records stored, I have a server here located at the office, what is my response to that? How soon can I get back up? These are the different things that we want to consider as we think about what risk. And not only that, environmental, you have also a disgruntled employee. If they leave the practice, how soon are we disabling their access? Is it immediate? Do we keep record of what access an employee or staff member has to make sure that we are checking off the hundreds of insurances that they have to log into, or the internal computer systems, just all of that we want to make sure that we're keeping track of, as well as did they return a key that they had? Looking at our asset inventory list, did they return the iPad that they used to use or take home, or laptop that they have? And of course, again, we want to make sure that we're documenting these. And so as we conduct the risk assessment, again, as I mentioned, it shows you just all your gaps and all the things that you need to work on. And so once you're done, you should receive what's called a mitigation report. And as you look at that mitigation report, this is key, right? Because a number of people have done the security risk assessments. You want to actually plan out how you're going to fix these different issues. You want to put an estimated completion date. Hey, we noticed that our firewall has not been updated. We need to install a new firewall. We're going to write down that should be updated or installed within the next 3 months. That's how you keep proper documentation. Again, I can go on for days. on this slide. But again, please remember the security risk assessment, the risk analysis is the foundation of you having and protecting your patients in HIPAA compliance.
That's excellent. There are several tools. One that's provided by the oh my goodness.
HHS.
Thank you.
Yes.
Healthit.gov is the website,
Yes.
and they actually have a free tool, of course, that practices can use. It's an excellent guide. It provides a lot of information if people really don't know where to start. It pretty much walks you through it, and it has an excellent glossary of terms because there's so many acronyms. So that's an excellent resource as well. But it's not just about what's in the EHR, as you said. It's any information for patients that we need to protect. And so it might help to have a collaborative atmosphere when doing this. I know usually one person is responsible for it, but it involves everyone in the practice, doesn't it?
Right.
So use them to find out where all the risks are, because they may know something that you're not aware of.
And typically when I conduct a risk assessment, so I mainly deal with the practice administrator or office manager, but then I also conduct an assessment with one of the employees, because a lot of times it's like, hey, we've instituted these policies. We asked them to do training. And then once you get to one of the staff members, they're like, no, that never happened, or I don't remember that. And so a lot of times, you know, when people see me, they call me the HIPAA police. I am not the HIPAA police. I am here to help. And one of the things that's important, as we talked about before, building that culture, you want to make sure that staff members, everyone knows that they play a part in the organization being HIPAA compliant. And so if there is a policy that hasn't been properly communicated, that doesn't fall back necessarily on the office manager as much as it is everyone. We want to ensure that any gaps or anything that's being communicated, that everyone understands what's going on. And that's really important as well.
So that takes us to our next helpful list of basic security tips, a checklist. Of course, we cannot include everything, but we're trying to do the high points here. You know, having strong passwords that you change regularly, maintaining, as you mentioned, the firewall and other antivirus software, controlling access to patient health information. Only those who really need to access it have access, not only to the digital records, but also to the physical files that may be kept in the practice, limiting network access, planning for the unexpected, conducting regular audits. And this may be an area where people have a particular challenge if they're not IT people, you know, how to do that. So maybe we can come back to that. Having a breach response plan. And if someone violates the policies, what are the consequences, or how is the seriousness of it communicated to all employees? And of course, in general, maintaining good computer habits, configuration management, software maintenance, operating maintenance, protecting mobile devices, and as you mentioned earlier, establishing a cybersecurity culture, a culture around protecting patient health information. Is there any one of these things that stands out to you that might be?
Yes, the firewall in particular, if you're not sure of what that is, typically it can either be software based or an actual hardware device that's in your network closet or where you may have your phone system. But I like to say that it's important that it's something called intrusion detection and prevention that needs to be enabled. And so the picture that I like to give, imagine your house and you have your security system, the more modern one that controls, you know, like your door locks and windows and just various things. And so when that's in place, you can control who enters and exits your house, right? And you're able to check and monitor if someone enters and exits your house. And if you don't want Uncle Chris to come by anymore, right, you can lock Uncle Chris out and say he cannot come here anymore and remove his keys. That's how that device controls what goes in and out on the internet. And if your house is not secure, anybody can come in at any point in time, right? And so if you don't have a firewall, anybody on the internet at any point in time can just come in and see, check, oh, you have these computer systems here. Oh, wow, that's cool. That's some cool information I can pull. And so I like to emphasize the importance of not only having a firewall, but ensuring that it's up to date, and also having that, what I call intrusion detection, enabled. And when that's enabled, it's able to say, Uncle Chris, you can't get in. Boom, 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 boom. And it's able to alert you, hey, Uncle Chris is knocking at the door. We don't want to let them in. And so anyway, that's really important, as well as you mentioned, having that sanction policy in place so that staff members are aware that if they do violate the policies, that there are consequences, right? That first one may just be a verbal warning. Hey, depending on the severity, right, of what was done. Hey, that's not proper. We no longer, or we shouldn't write our passwords down in a notebook. Hey, that's not proper protocol. We have a policy against that. And of course, with good computer habits, good cyber hygiene, you want to make sure all the programs are staying up to date. Also like to share, let's make sure we're not downloading coupon programs or random programs from the internet. What should be on the work computer is work related. So
yeah, very good practical information that you shared with us there. And so those sanctions and things like that should be included in your policies handbook, right?
mm-hmm. Yep.
And as we move on, someone has to manage all of this. So who is the designated security officer that will be responsible, and the point of contact, and the person that ensures that all of these things that are required take place? They would be responsible for creating and updating sufficient policies and procedures. Don't let it collect dust. Conducting and monitoring the annual HIPAA workforce training and obtain signatures once the employees complete the training, and keep a record of that for at least 7 years. And then they would also conduct the HIPAA security risk assessment to monitor the physical, administrative, and technical safeguards. If there are any security incidents where PHI may have been breached, they would investigate that and then try to come up with a remediation plan, and also report those breaches if they meet the criteria for reporting, and to post reminders in places where it's kept top of mind for staff, and maybe even electronically, periodically sending reminders or tips. And then if they want to report something anonymously, then they can do so as well to you. And make sure that the business associate agreements are up to date. So that's an overview, but it's a lot of work, isn't it? To keep all of this maintained.
Mm-hmm.
So if we're not hip to HIPAA, in our next slide, what are the risks? Can be pretty hefty, and a fine can be applied on a daily basis. For example, a covered entity has been denying patients the right to obtain copies of their medical records, and they've been doing so for a period of 1 year, the Office of Civil Rights may decide to apply a penalty per day that the covered entity has been in violation of the law, and the penalty could be multiplied by 365, and not by the number of patients that have been refused access to their medical records. So these fines can be pretty hefty. And the state attorneys general can file civil actions with the federal district courts with a minimum fine applicable of $100 per violation. So it's pretty serious. And we could go into more detail, but let's go to the next slide and see what some of the problems can be, because, as we know, there is a huge market for this kind of information, for healthcare information, as cyber criminals consider it very valuable. And so we really want to do all we can. And the emphasis from OCR is that, not taking it seriously will be dealt with seriously. So as we go on to the next one, we see, this one. What are the worst case scenarios? What are some of the examples of things that have penalties that have been not just financial, but also lack of freedom for those who perpetrated the violations. 22 years in jail is quite a bit for wire fraud and aggravated identity theft, a 3-year jail term for VA employee who stole patient data, 2 to 6 year jail term for receptionist who stole PHI from the dentist's office. Patient care coordinator gets 1 year in jail term for HIPAA violations. So the civil penalties can be quite severe.
Yeah, and the regulation was implemented, I believe, in 2013 that made it individualistic, right? So it's not that just the practice or organizational level, but if it's found that you, as we see here, have violated HIPAA in some type of way, you can be individually held responsible for doing so. So it's important. Obviously, penalties, the risk of jail time, reputation of the organization. There's so many things that go into just the motivation to ensure that each organization is being HIPAA compliant.
Oh, that's very good. Let's see. I'm looking at, just saw, I think, another question. We will get to that. That is an excellent question. Does the whole assessment, the security risk and assessment, have to be done every year? And yes, the assessment has to be conducted annually every year. You have to document that it's been conducted, preferably save that documentation with the name of the practice and the year, the date that it covers. You don't, if, and it's unlikely that there are absolutely no changes, then the document wouldn't have to change, but there are changes, new equipment or new staff members, new responsibilities, new roles. Any kind of change in the environment that affects PHI, then that should be documented in the security risk assessment. And are the SAFER guides the same as the security risk assessment? They're very closely aligned, but they're not the same. And so that's a great question that maybe we can touch on more a little later if we have time. Thank you so much. So I wanted to just give folks a heads up on what is projected. It is not policy yet, but this is what's projected to come down the pipe. Well, as far as the this first slide, yes, this is already the rule. What's new on the HIPAA horizon? As many of you know, the COVID-19 public health emergency, or PHE, will come to an end on May 11th. That's less than a month away. And so the HIPAA notification of enforcement discretion will also expire at that time. And so the one that may most impact our small practices or other organizations here are the telehealth remote communications rule, the unprecedented HIPAA flexibilities that were introduced during the pandemic to ensure that HIPAA compliance didn't get in the way of the provision of high quality patient care will expire with the expiration of the PHE. And so from that date and time, there will be no further flexibilities, and non-compliance will be penalized in the same manner as before the COVID-19 pandemic, with the exception of the transition period that will be granted to the telehealth piece. So covered healthcare providers can use this transition period if they need it to adjust their telehealth practices to come into compliance, such as by choosing a telehealth technology vendor that will enter into a business associate agreement and comply with the applicable requirements of the HIPAA rules. And so they may also review and update any policies and practices developed and implemented prior to COVID-19 for compliance with the HIPAA rules. And so we can share those resources after the webinar when we send our follow-up email. And so what else is new as we move on? HHS proposes measures to bolster patient-provider confidentiality around reproductive health, and this seeks to strengthen the HIPAA protections under the privacy rule. So this proposed rule is intended to extend additional privacy protections to patients, insurers, providers, and others to safeguard PHI when that information otherwise would be disclosed or used to identify, investigate, sue, or prosecute someone for seeking, obtaining, providing, or facilitating lawful reproductive health care. Reproductive health care would be defined to include, but not limited to, prenatal care, abortion, miscarriage management, infertility treatment, contraception use, and treatment of reproductive related conditions, such as ovarian cancer. While the department is undertaking this rulemaking, the current privacy rule remains in effect. And as explained in Office of the Civil Rights Guidance, it's such a tongue twister for me, the existing privacy rule permits but does not require certain disclosure to law enforcement and others subject to specific conditions. So what else is new on the horizon? New proposed HIPAA privacy rule changes for 2023. There is a very long list. I only put a few of the proposed changes on this slide. Tried to pick out the ones that might impact your policies and procedures more strongly. So one of them is to allow patients to inspect their PHI in person and take notes or photographs of their PHI. Changing the maximum time that you have to provide access to PHI from 30 days to 15 days. Broadening the definition of healthcare operations to cover care coordination and case management. Covered healthcare providers and health plans will be required to respond to certain record requests from other covered healthcare providers and health plans when individuals direct those entities to do so when they exercise the HIPAA right of access. So this one is very interesting. It really shows the emphasis that's going to be put on care coordination, I think. And so if you're going to have to share records, how are you going to do so securely and be compliant with HIPAA? Will you use HIE, Health Information Exchange, such as what Hybrid Solutions, one of our provisions is the Health Information Exchange, to securely share that information with small organizations and also larger organizations, or secure messaging, or what other ways will you would be able to respond to these records requests in a way that's HIPAA compliant? You have any thoughts on that, Arian?
Just to be aware, I believe that the current census is giving more patients responsibility to manage their care is the goal and emphasis of a lot of these new legislation changes. And so with them taking more responsibility of ensuring their records are up to date, or it says what they mentioned in the exam room, a lot of these things are in support of that. But at the same time, I think too, with a lot of the changes, again, as you mentioned, this is a very short list. They're also taking into the consideration of the burden that's been placed on a lot of organizations, and they're also trying to implement different legislation along with that to help ease some of that burden as well. So it's not just, hey, here are all the things that you must do, but we also understand that there's a cost associated with these things, and they're trying to implement legislation to support that as well.
That's an excellent point. And one of the things that is on that list is that covered entities will not be required to obtain a written acknowledgement from an individual that they received a notice of privacy practices. I know that takes quite a bit of time and focus when
Yes,
for every single patient that comes into the practice. Yes, so this is quite an extensive list. And again, it's proposed, it's not is on the HIPAA horizon. We just want to give you a heads up so you can start thinking about ways in which your practice might need to update those policies and procedures. So it might be a little painful at first because you will have to update policies and procedures, but then in the long run, the intent is to reduce administrative burden and to make care coordination and case management more, the exchange of information flow more freely while securely. So what else? Health and Human Services proposed a new rule to further implement the 21st Century Cures Act, modifying and expanding exceptions in the information blocking regulations to support information sharing. So this is something else to keep an eye out on. Unlike HIPAA, where regulation outlines when information is permitted to be exchanged, information blocking regulations are directive and require actors to provide access, exchange, and the use of electronic health information for nearly all requests. So something else, a whole nother topic we could talk about. We didn't plan on covering that today. So we might want to swing back around to that question. Are the safer guides the same as the SRA? I know I didn't put this on our list, but do you have any insight into how these two work together to help us be compliant?
So the safer guides have actually been around since like 2016. And the purpose of them was similar to the security risk assessment, but more so focused on how you enter patient data. It allows you to sort of question how you submit or support or organize different things. And so within the safer guides, you have to answer certain questions like, hey, do you do this with your EHR, or is this done, or this, that, or the other? And it's actually listed on one of the HHS's websites, but they're two completely different. Again, the security risk assessment is more thorough as it looks at the entire practice. But again, the safer guides, they have some pointed questions that will help you also assess certain things. So they're similar, but they're different, as you mentioned before.
We also have another question. This is a very good question. Can you think of some examples of policies that a practice should have with regard to HIPAA privacy rule outside of the standard HIPAA manual? So the privacy rule outside of the standard HIPAA manual.
I can think of several, right? Password policies, as we mentioned before, sanction policies, also your security posture policies. So basically that lists how you have organized your different systems and how you protect those systems. There's like, so again, I could go on.
Well, guess what? We have a couple minutes. You can go.
Also, you have your disaster recovery and emergency mode operation plans. So essentially, you want to be able to list out how do you back up your current system, whether you host it in-house or through your EMR. If your EMR is responsible, like say you host your EMR in the cloud, if they're responsible for backing up your patient medical records, you want to get something from them that states that, and you want to be able to add that to your policy. And also, along with disaster recovery, if something happens to your facility, it lists out, hey, if this happens, this is our plan for this, as well as alongside of that, the emergency mode operations plan. So if your practice is shut down for a day, this is what's going to happen. This is who we need to communicate to. And then, of course, you have your incident response. So as we had talked about a lot of times with your cybersecurity threats, if for whatever reason somebody clicks on a link that they're not supposed to, that incident response gives instructions to the individuals on how they should contact your security officer, who your security officer should contact in the event that something happens. And that's all within like contingency planning. But also you have your privacy side, right? Like, how do we share information? The policy that states how often or how soon we should get or respond to patient medical records requests. Within that too, like access levels, minimum necessary information, right? Having job descriptions and job roles within your assigned EMR. Like if you're a nurse should get XYZ privileges. And if you're a smaller practice where everyone has sort of like the same level of access outside of the administrator role, you want to be able to list that in your policy as well. Like, hey, we only have 4 staff members. They, again, wear a number of hats. And so they need access not only to the billing, but also to the clinician side. And your MAs, they have access to writing prescriptions. It's just all these policies and procedures list out how you run your organization and the different steps that you have to work through as you protect patient information, if that makes sense, if that's like the best way to sum it up.
Yeah, that makes sense. And this is something you help practices with. So you're intimately aware of some of the pitfalls and then some of the resources and things that they can use. And because of your background as, I know your minor is health informatics. I'm not going to forget that because that was my major. But your major was
information technology.
Yes, IT.
Yes.
So that really helps in this role because you understand the backstory of
Right.
how to reach that compliance on that level.
And being in the space for, again, like close to 15 years, I've seen it all. I've seen and heard it all from, again, when I was in the practice itself to me helping other organizations, whether large or small. I don't think that there's anything surprises me to this day, but again, you never know. There's always just some random something.
Well, there's new stuff on the horizon. So.
Exactly.
Oh, we're so glad that you found that information helpful, and we're so glad that you participated on our webinar. It's just a pleasure to serve this wonderful community of heroes as they help everyone with their health and well-being. We want to help you maintain your practice health and well-being. So I'm going to throw it back over to Selena, and she's going to close us out with a few announcements and other information.
Thank you so much, Ariane, and thank you, Phoebe. Again, thank you for participating on our webinar. That was some very valuable information. Also, some additional upcoming learning opportunities is we are working with the Center for Leadership and Disability Training opportunities. And these are a couple of trainings. Responsive Practice 1, providing healthcare and screening individuals with disabilities, and then Responsive Practice 2, accessible and adaptive communication. So there's also continuing education credits available for these trainings as well for physicians. Right now, I think they're just offering CMEs for physicians and nurse practitioners. So this is trainings that you can take advantage of at no cost to you or your practice. Our next upcoming webinar will be May 16th, and it will be around mental health awareness. Again, here's our contact information. If you have any questions or concerns, please reach out to us. And again, thank you guys for joining our webinar today.